really is accentuated quite a bit to where people are running towards the fire rather than leaving, and how folks have come together, and all the sacrifices that they've made. We're doing the right things, and I'd love to be criticized in 2 months for over preparing and overspending for this, but I'll gladly take that criticism if we get to that point.
Today is Tuesday, April 7th, and we are pleased to be joined now by the President and CEO of Appalachian Regional Healthcare System, Chuck Mantooth, who has been obviously very busy preparing our regional healthcare system for dealing with this COVID-19 crisis, and also dealing with so many other things that go on in our medical community on a daily basis. So first of all, Chuck, thanks for joining us here. I know it's been a busy time for you, but appreciate the time here today.
Yeah, absolutely. Pleasure to be on here. And we actually were chatting a little bit before the recording. I've got apparently some big shoes to follow with some folks that have been on here before. So
Dr. Scott Elliott gets big ratings. So
he's my neighbor. I'm gonna really have to try to up my game here.
Absolutely. Well, tell us a little bit about what the situation's been like, not only at Watauga Medical Center, but really throughout Appalachian Regional Healthcare System as you've readied for the potential impacts of this crisis.
Yeah, well, first of all, I've got to make this quick comment that I've really been amazed at how our staff has really just stepped up and come together. You know, one of the things I think we pride ourselves on is the quality of the people that work here, and that you know, they see it as a honor to take care of folks in this community. And in a time like this, it really is accentuated quite a bit to where people are running towards the fire rather than leaving, and how folks have come together, and all the sacrifices that they've made. So that's the first place to start. You know, interesting, I was looking back at some documents, and the last 6 weeks feels like 6 years. I know to many folks feels like that to us here. And we really started talking about, you know, a response that we needed to address on a local level, you know, from what we were seeing all the way from China to then the first infections in the US, and then how they drift into North Carolina. And it's amazing what's been done in 6 to 7 weeks around the preparation. If you've driven by at least Watauga Medical Center, you see a visual representation of that with the police force there kind of restricting access and tents and those type things. So we've done a lot to prepare. A lot of that's on our website. I'm really proud of the work that our corporate communications, they work quite a bit with you to make sure that we inform the public. That was probably our biggest challenge early on, is how do we get the right information to the right people so the community can organize and do the right thing to try to flatten that curve. So we've done a lot. It's interesting too, because a lot of the ingenuity that's been put into doing things a different way, like telehealth. I think I talked with our chief physician executive, Dr. Danielle Mahaffey, yesterday, or actually this morning, and we've performed over 160 telehealth visits in our primary care and different doctors' offices. 2 weeks ago, we didn't even know how to do that, or didn't even have that capability. So it's those type of things, those adjustments that we've made, not only in our physical plant to try to keep potential patients contained and treated in a certain way, but then also how to make sure that we also don't avoid and totally disregard others that need care other than just COVID-19.
You mentioned the tent a moment ago. It's one of Boone's great attractions for those that are driving by and getting out of the house these days, which they're not supposed to be doing, but they still do nonetheless. Driving by and seeing the tent out in the parking lot of Watauga Medical Center, what is that for? What purpose does that serve?
Yeah, so we recognized early on that we were going to probably be in a situation to where we were going to have to keep patients out of this facility and have an alternate site. So we got ahead of the game. The Avery County, we actually got that from emergency services over there as early. We figured we would probably use it for multiple sources. So it's still that way. We're not going to put a circus in it, but at some point we thought we may use it for drive-by testing. We may use it for an alternate treatment site. So it's really there as part of our surge plan should we see a large number of patients that really kind of overwhelm what we're able to do here in this building.
You mentioned that Avery County and Cannon being the facility there. You've got facilities spread out throughout Watauga County and really a multi-county service area. What precautions have you taken to make sure that you're able to maximize the full use of your capacity at not only your main centers for maybe emergency care, but some of the other facilities as well?
Well, I think the best place to start is the coordination has been incredible. In times like this, we have an emergency management plan, and we've had drills in the community to where we've worked with the fire department, the county, Appalachian State University, and various leaders here in the county around certain scenarios. Obviously, this is not one that we saw coming, but we've used those documents and plans in preparation for really what we're dealing with right now. So as part of that, coordination with the health department, the county, and all that, but then we have an individual response that we have to make. And what we did is just basically back in probably late March, we moved from kind of a fluid planning process, and we said, okay, when the county declared a state of emergency, we really went into incident command functioning at that point. And as part of that, we coordinated everything that we're doing, not only our doctor's offices, our hospital here in Watauga, but then also in Avery County, Cannon Memorial. We organized it there. And then also what we've done is develop a surge plan. It's really a four-pronged plan. It's different triggers that would move us to really doubling our capacity or possibly tripling our capacity. And doubling our capacity, which is really kind of the third phase on a surge plan, we can contain that within our own facilities, and that does involve Cannon and some other resources we have here. Beyond that, our plan involves more of a county and state response to where we may move patients outside of this facility. I hope we won't get there. I think that the things that you've encouraged and the response that I've seen in the community as far as social distancing, we're doing the right things. And I'd love to be criticized in 2 months for over preparing and overspending for this, but I'll gladly take that criticism if we get to that point.
A lot of media focus has been on patient counts, resource counts, allocations coming from government to help supply hospitals with more resources. And certainly those things look different in different areas of the country. What has that experience been like here? Do you feel like you've got the necessary supplies to deal with the number of patients you may be seeing now or may see in the future?
I do. We actually, as part of that incident command process that I described earlier, we have a separate unit that really kind of daily monitors our what we call a burn rate. And when we say PPE, it's just all the protective equipment, and that may involve masks or gowns. And so there's a large array of things within that, what we call PPE. So we're monitoring that daily. Our materials management folks, personnel led by Mike Rawls, did a really good job early on. I joked with him and said, I wish you were in charge. You were in charge of my retirement account. You could have seen this coming and made some changes there, because he really did do a good job of finding that balance between making sure we were prepared, but then also that we weren't hoarding and we weren't trying to make sure we weren't just getting as much as we could. So we monitor that burn rate, what we call that burn rate, on a daily basis. Now that really increases a lot if we'll start seeing some positive patients here in the hospital. The problem we have right now is around testing. So, for example, we've had multiple patients come through that we're going through a process of ruling out, and what we call those are persons under investigations, or PUIs. And what you have to basically assume that they have the virus, and if a delay in testing is 4 to 6 days, you're burning through a lot of PPE, and so your burn rate goes up quite a bit. So there's some variability in those calculations, but for the most part, we feel pretty prepared to a certain level. Therefore, the surge plan is really the most important piece of it. Like, you hear a lot about ventilators. Those are things that we just have a limited number of those, and we're relying on really our work with not only local emergency management, but the state moves all the way up to the federal to deploy those ventilators should we ever get to that point.
some of those resources have actually come into a little bit more of the individual use here lately in thinking about some of the recommendations that App Healthcare and some others have put out regarding wearing masks in public places where social distancing might not be as easy to accomplish. Where do you see that that easy place for people to understand, hey, I'm in place X and this requires me to have that mask? What does that look like from maybe a numbers standpoint or a social engagement standpoint?
Yeah, so it's changing rapidly, and actually, I think we just put out a day or two ago. Well, on Friday, the CDC came out with some guidelines, and that information is available on our website for folks that want to really take a look at that. But we digested that, and we basically came out and said basically we're in support of that. And I think the way it's written is that if you're in if you're first of all, staying home is the best way to manage this. But if you are in public and you can't maintain a safe distance, they are recommending to wear the cloth masks or a medical grade mask. But the actual advice is listed on our website. But I think this could be something that folks could get really creative around. Like, App State could probably do an App State, cloth mask, or, ASU football or whatever for other folks. So we could probably make it something fun, but then also safe too. So I know no one wants to wear a mask, but I do think the CDC is right in coming out with the guidelines that they've put out.
Whether it is cutting up your favorite T-shirt to make a mask, or coming up with things like this around the house to make sure that you're dealing well with things. People have adjusted to better hygiene standards, hopefully, and I'm sure that's a difficult thing to manage in a hospital because of the type of traffic that you have and the fact that you're in such a fluid situation with different things going on, different levels of access. How have you managed making sure that the facilities, all of them, stay as safe as they possibly can, not only for the patients but for your staff especially?
Yeah, so for us, it was basically just being more consistent in what we already know to do, especially hand washing, those type things. And one of the cool things that we've done, actually, David, is so we've shifted what we've built really over the last few decades, is a health system that's really less emphasis on what we're dealing with right now, the really heavy acute patients, to trying to move upstream to keep the community healthy. And that represents about 70% of what we do. So as we shift away from that and really kind of only take care of the most urgent, there's a lot of folks that have been asked to do different things. And here's the point. This hospital is probably the cleanest that I've ever seen it, just because we've taken folks that, worked in our wellness center, worked as a nurse on a floor that's basically, I see them cleaning. And so we've taken an opportunity to prepare and make sure that we emphasize the things that we already know. But those are some of the few things that we've done.
Do you feel like, from a human resources perspective, maybe one of the things that we learned from this overall is the value in cross training?
Oh, absolutely, absolutely. This is when I talked about the response that we've had from the people, and it's really the quality of folks that work here at ARHS. You see that in these times. And so it's been easy to kind of ask folks that did one thing one day to do something different the next day. But the more cross training that we can do, I think that, obviously there's a licensing that we have to work with, North Carolina license to be a nurse and things like that you have to do. But the more that we can have folks that understand other roles that we could quickly deploy and put in places, especially in a time like this, it's really invaluable.
If you can, Chuck, run through the process, because I know that you've made some adjustments to it since all of this started, about what patients should do if they feel they have symptoms. How should they engage with the system at that point?
Yeah, so I mean, obviously, we're getting a lot of folks that, obviously, all the guidance is, I would say, the best resource is what's on our website, because basically what we take is recommendations from the health department, from the state, and it's usually coordinated with the CDC, so there's the latest guidelines. And that has changed. It's been a fluid process, because at one time we were doing a lot more testing than actually what we're doing right now. So But folks that are having those symptoms that are really listed on our website, and I'm not going to say this because I want to make sure that I get them right, those cough and fever and those type of things. If you need medical care, come to this hospital. For folks that are really just been exposed and they're really not sure, that's probably not the place. We're not the place to come. And really the best guidance is to contact the health department. So, I mean, our ERs are here, but we're doing a little bit better job to make sure that we're screening appropriately for folks that get into the ED that actually need that care.
I think one of the other questions out there right now is with so many different services either limited or suspended during this crisis time. If you break your arm, if you need to come to the hospital for some of those traditional things, how do patients access in that way?
Yeah, just in the normal manner. Basically, so here at Watauga, obviously we've got limited access, and that's controlled with law enforcement and just as a presence to make sure that appropriate folks are coming in the community. But really, regardless if you have COVID-19 symptoms or, to your example, a broken arm or some other acute medical need, it's really kind of business as usual once you get past that initial entry point.
Okay, we're spending more time outside. Things do happen. A couple final questions for you. This is such a helpful community at all times, and this has been one of those rare occurrences where the hospital is actually, and the hospital system has turned to the community for some help with hand sanitizer and some supplies like that. What are some other ways that the community can engage to make sure you and your staff have everything that you need to fight this virus at the medical front line?
Maybe a little unorthodox, but I think the staff really responds to letters. Letters of support. That's one way. I mean, that's easy. If someone is at home, they could take 5 minutes, write a letter, just send it to me. We'll make sure we get it to the staff. Just a little letter of encouragement. We actually started. So there's one entrance for all employees that come in the building every day, and everybody goes through that entrance, and we temperature check. So that's something that we started probably 10 days ago. And on the entrance in there, folks I'm not sure who did it, but have written positive messages on the sidewalk in chalk. So those are really needed, but more probably tangible items would be cloth masks. I mean, really, if we could get creative around folks just taking the time to make these cloth masks with, under certain guidelines and give those to us. I really think, I haven't run this by Rob yet, David, so he may get mad at me. But I really do think that's a great opportunity we have now that we're kind of moving to more of a mass type protocol. That could be a fun thing. One of the other things too is it's developing, and probably we'll need to get some information out there, is that we've engaged alternate sources that have 3D printers to basically print some of the materials that we can easily put together for face shields. And the local Rotary Club, Sunrise Rotary, I think they're kind of standing by waiting to be engaged or pull together if we need them. But that's something that we could potentially pull together in the future. Again, Rob's the great organizer in this, so I better make sure that he's in agreement with all this.
Final question for you, and we touched on this a little bit with the human resources side of this, but put your crystal ball in front of you for a moment and think back to some of the experiences that you've seen you and your staff go through in the last 6 weeks, and will go through probably for several weeks more. Is there something that has been stumbled upon, created, maybe realized through process that you feel like could be maybe a need or a necessity at this point in time that becomes standard practice 2-3 years down the road from now? From an ingenuity standpoint, rural health is always something that presents some unique challenges. Has there been, an instance where maybe a process has emerged that you feel like can make your overall operation better once we're done with all of this stuff?
Yeah, internally, I would say that we talk as an organization the speed of communication, and one of the things, we have a 2:00 call every day. It's an incident command call. And we have folks that are actually trained in those incident command procedures. So it's not me, it's not executives leading it, it's other folks that are trained in emergency management. But really what that functions as is a daily huddle. And we can go through 15 minutes, and within 15 minutes, everybody in this organization has an opportunity to learn exactly what's going on that day. So I do think that's something that could stick. It's something that we had tried to deploy earlier, just daily huddles. just getting together and talking about what needs to happen this day. Do folks have what they need? Those type things, and you can run through that in 15 minutes. So organizationally, I think there's some value there that could stick. The other part, really, and I really do think we have a great opportunity in a rural community. Is this idea we talked a little bit about the use of telehealth. My 82-year-old mother in Concord, North Carolina, got on a telehealth visit this week because of some issues she was having with her hands, really. And my sister had to go set it up for her. But if my 82-year-old mother can do a telehealth visit, it's great for this community where sometimes, we're challenged by distance. So I think that's something that could stick. And before there was a lot of regulatory restrictions around that, but since those have been loosened, we've really seen the value in that, not only for our providers, but I think for our patients too. So those are two things I think that could stick for us.
Well, Chuck, I know I speak on behalf of the entire community when we say that we're behind you and your staff and everything that you all are doing, all of the various levels of healthcare right now. It's so incredibly important to the safety of this community, and everybody salutes you and your efforts and everything that your folks are doing on a daily basis. So thanks for taking some time to educate us on some of those things. And we wish you low patient counts and hopefully a lot of idle time on your hands, hopefully, as we deal with this.
We do. And I want to take a second to thank you, David. I think that this is a time where the work that you're doing on the part of the chamber, where, obviously our small businesses are in jeopardy. I realize that. And the work that you're doing to pull us together, it will pay off over time. So I want to take a chance to thank you also.
Well, on behalf of our team, thanks for that too. We look forward to talking to you again soon.
Thanks, David.